Welcome, everybody. And thank you to our presenter, Crystal Kaloff. Is it Kaloff?
Yes, Kayla.
Crystal works in our home health and hospice department. Is that right?
Correct. Yes.
And is very, very very familiar with the long-term care options that she's going to talk about. And at this point, I'm going to turn the meeting over to Crystal, and she'll tell you a little bit about herself and what she does, and then we'll start our program. Thank you, Crystal.
Thank you, Melissa. Thank you so much. And thank you to everyone for allowing me to be part of this. I'm very, very excited. Like Melissa said, my name is Crystal Califf, and I am a social worker. I have about maybe 15 years of experience being a social worker. I've done a little bit of everything. I worked with children, I worked behavioral health units, and now I'm here at Glendale working with home health and hospice. And I've been here for probably about almost 2 years now, and I love it. I love being able to go to many people's homes. I'm sure I may have visited some of you, and if I have, hello to you if I've been there. And today I do have a lot of information I'm going to be giving. I did my best to try to minimize and give you the most important aspects of different types of care options for you. I will be, I think, going over 4 in particular. I think that these are the 4 that most of us like to consider and are usually recommended by our physicians. So if it's okay with everyone, Melissa, may I go ahead and get started?
Yes, please.
Wonderful. Okay. Okay. So today's topic is long-term care options, and I will be discussing private homes, assisted livings, boarding care, and skilled nursing facilities. Okay, so what is long-term care? Long-term care, LTC, is a variety of services which help meet both the medical and non-medical needs of people with a chronic illness or disability who cannot care for themselves for long periods of time. Long-term care can be provided at home, in assisted living facilities, or in nursing homes. When most people think of long-term care for seniors, they think of nursing homes, which is also known as a SNF, but it can involve much more than that. Seniors and their families have a wide variety of housing options to consider, depending on the senior's health status, mobility, and need for home care. Private home, also known as aging in place. More seniors are choosing to age in place. Aging in place means staying in their home rather than moving to an alternative retirement setting. This works best when the person, the place, and the support network are all in place. When aging in place, all the services that might be available at a senior living community must be provided for the person aging in place or their support network. And by that, there's a couple of options. I believe some of you might be familiar with in-home caregiver, home health care, hospice, and in-home support services. The likelihood of aging in place being successful is much greater if everyone involved does some conscious planning. The first step is to think about the kinds of help you might want in the near future. Maybe you live alone, so there is no one living in your home who's available to help you. Maybe you don't need help right now, but you live with a spouse or a family member who does. Maybe think about finances, securing a support system, consider transportation services, and review changes in your level of independence. And I skipped ahead very quickly, so my apologies. In-home modifications help seniors maintain quality of life by preventing injuries and loss of independence from early admission to an assisted living or a long-term care community. You may want to consider installing grab bars for toilets and tubs, or installing a walk-in tub or a tub seat. You may want to remove unnecessary throw rugs and fasten down rugs or floor runners to prevent slipping. You may want to move furniture to create a clear walking path. Keep objects off the floor and coil or secure cords to the wall to prevent tripping. It may not make sense for you to stay at home if any of the components are compromised. For example, a health event or a progressive condition that requires more care can trigger a decision to move. Or it may be loneliness or the desire for community that makes a move a better solution. Now we're going to talk about assisted livings, also known as retirement homes. It's important to remember that an assisted living is not a sign of defeat. Rather, it's a viable living option that can help ensure your safety and address your needs. Think back over the last year or so and see if you can recall any of these issues. Have you had difficulty with meal preparation? Is it getting harder for you to safely stay at home and maneuver around? Do you need more help getting dressed? The most common assisted living services offer medication management and assistance with dressing, grooming, housekeeping, meals, laundry, and transportation. You also want to make sure that you think of an assisted living more like an inclusive hotel for people that are retired. Assisted living residents may usually live on their own apartment or rooms and share a common area. Think like an apartment setting. And the most common assisted living services offered include medication management, like I said. You can also bring into an assisted living someone that can assist you with home health care, hospice care, and private pay caregivers. And staff is usually available to help with safety and provide support and care. I also kind of went through this already, so I'm going to repeat myself, so my apologies. Again, it's not a sign of defeat. It's a viable plan and option that can help ensure your safety. Again, think back over the last year and recall if you've had any of the issues, meal preparation, if it's getting harder for you to maneuver, and if you need more help getting dressed, bathing, or managing your medications. Now, assisted livings can be a little expensive. The costs vary from one community to the next, resident size, types of services that you need, and even which part of the country you live in. Assisted livings can range anywhere from $3,000 to $6,000 or more a month. And unfortunately, at this time, Medicare, Medi-Cal, also known as Medicaid, does not cover assisted living. So most residents that live in assisted livings pay for this kind of care from their own personal resources. And the next topic I'm going to speak about are boarding cares and residential care homes. A boarding care is a residential home for senior adults located within a residential neighborhood. These assisted living properties typically are small and intimate, caring for about 6 senior residents at a time. Boarding care homes also go by the names of residential care homes. And it's very important to note that in the state of California, boarding care homes operate in a residential neighborhood and generally only allow 6 residents. The services provided at a boarding care are similar to those provided at an assisted living, but in a home setting. Staff in a residential care home help with a wide variety of personal services, medication management, activities of daily living, meals, housekeeping, and transportation. One of the main differences is that the board and care typically do not provide 24-hour skilled nursing assistance. In a boarding care, just like an assisted living, you are able to have supplemental assistance such as private caregivers, home health, and hospice. Who usually lives at the boarding cares? Boarding care homes are most appropriate for residents needing a lot of hands-on physical care, or those who do not benefit from the dining rooms, movie theaters, and activities of larger communities. In the Los Angeles area, the majority of the boarding cares cater to residents with mid to late state dementia and conditions that make the individual no longer able to ambulate. Boarding care homes may be a better fit for elderly loved ones who prefer a cozy, intimate, and home-like environment, need some help with everyday tasks like dressing and bathing, but do not need 24-hour skilled care, want the privacy of a bedroom without all the responsibilities of an entire apartment. So housekeeping is taken care of for you. Maybe it's not something you're able to do at home anymore. And the cost of living in a boarding care home depends largely on the location. Because the homes are private residences, cost is tied to the estate value. So you are looking at a cost anywhere between $3,800 or $3,000 to about $5,000 a month. It could possibly be more than that. The cost also depends on room privacy. So a shared room costs less than a private room. Okay, the next topic is going to be skilled nursing facilities. A skilled nursing care is the highest level of medical care that must be provided by or under the direct supervision of licensed health professionals, such as registered nurses, physical and speech and occupational therapists. A SNF, a skilled nursing facility, is required to provide 24-hour skilled nursing care as well as rehabilitative services. Also at a skilled nursing, hospice care is able to be provided. Skilled nursing facilities have more of a hospital-like feel to them with hospital beds, medical equipment, and more thorough medical attention. These services can be necessary over the short term for rehab from an illness or an injury, or they may be required over long term for patients who need a high level of care on a frequent or constant basis due to a chronic medical condition. The typical resident is a person who is chronically ill or recuperating from an illness or surgery and needs regular nursing care and other health-related services. Some people stay at a nursing home for a short time after being in the hospital. After they recover, they go home. However, most nursing home residents live there permanently because they have ongoing physical or mental conditions that require constant care and supervision. Residents in skilled nursing facilities are under the care of their physician or the physician's medical director. Now, this next information about insurance coverage is a lot. So I'm going to give you just the basics so you have a little bit of an understanding. So skilled nursing facilities, will my insurance cover my stay? So I'm first going to talk about Medicare. So Medicare Part A can potentially cover up to 100 skilled nursing days. Your coverage through Medicare is contingent on your benefit period. Overall, the first 20 days are covered at 100%. If you stay in a nursing home longer than 20 days, between day 21 and day 100, you may have a share of cost. If you are in a nursing home beyond 100 days, Medicare does not cover, and you would be responsible for that. Medicare Part A is a coverage for inpatient hospital days, care in a skilled nursing facility, hospice care, and some home health care. In order to be admitted to a skilled nursing facility, a physician must certify that the patient needs skilled nursing care. Skilled nursing care is considered physical and occupational therapy, medications, medical equipment and supplies, and social services to help you meet your health care goals. you get these skilled services in a SNF that's certified by Medicare. In order to be admitted, you must have a minimum of a 3-day inpatient hospital stay and be admitted to the skilled nursing within 30 days of hospital discharge to qualify for Medicare coverage. The requirement is that a patient must receive daily skilled services. And a couple of examples of skilled services are overall management and evaluation of your care plan, observation and assessment of any change in condition, any feeding tubes that you may have, any rehab that you may need, so physical or occupational therapy, and gait evaluation and training. And so now we're going to talk about Medi-Cal, Medicaid. So we discussed Medicare, and now we're going to talk about Medi-Cal, Medicaid. To begin with, to be eligible for skilled nursing Medi-Cal, an applicant must be at least 65 years of age, blind or disabled, and you have to meet the resource limits. So just so everyone knows, Medi-Cal is income-based, and the state of California has set a certain income requirement in order for you to be qualified to receive Medi-Cal. Medi-Cal will pay for a nursing home only when it is medically necessary. California defines medically necessary as when it is reasonable and necessary to protect life, to prevent significant illness or significant disability, or to alleviate severe pain. For Medi-Cal to pay for a nursing home stay, your treating physician must prescribe a nursing home for you because you either need the continual round-the-clock availability of skilled nursing care or what's called intermediate care. And intermediate care means a protective and supportive environment with observation and on an ongoing basis to avoid health deterioration. If you are qualified for Medi-Cal, most of your income from SSI will be used to pay a share of cost. So California's SSI program pays for some non-medical custodial care in skilled nursing. So that means if you receive SSI, you will have a personal needs allowance, which is $35 a month. And I'll go ahead and give you an example. I know that sounds very confusing. I myself sometimes get confused. But what that means is, let's say your SSI, your gross income is $1,200. So that is a check that you get, right? $1,200. They will subtract $35 a month for you from that cost, which is yours while you're in the skilled nursing. And your SSI will then be put towards your stay, and the remainder that's put towards your stay is $1,165. So you only get $35 out of your $1,200 payment. And then I do have some more information on Medicare coverage. If you are not sure if you have Medicare Part A, make sure you take a look on your red, white, and blue Medicare card. It will show Hospital Part A on the lower left corner of the card. You can also find out if you have Part A if you call your local Social Security office, and the number is listed. That number is 800-772-1213. And also, please, I tried my best to make sure that I had the most up-to-date information for you, but I strongly urge you all, if you do want to get more information, that you go to the Medicare website, which is www.medicare.gov, or you call Medicare at 1-800-633-4227. And then also information on Medi-Cal. For the most current information on skilled nursing coverage, please call Medi-Cal directly, I do have 2 numbers listed, 877-597-4777. And then there's also a website, which is dpss.lacounty.gov. And they do go ahead and give you lots of information there. Like I said, I know that I may have overloaded you with a lot of information, but I just wanted to make sure that you all knew that there's options, different levels of care. You don't have to feel that you immediately have to leave home and go straight into a nursing home. If that's not your need, then that's not what you have to do. You can stay home if you wish and just make sure you have a plan like we discussed and you have everything in place to maintain your safety at home. As a social worker, I can tell you that that is one of the first things I go in looking for. I go in to make sure that you're safe, you have a plan, and you have a support system, and that you have all those numbers easily accessible to you in case of an emergency. And if for whatever reason, if home is not an option, then you definitely look into assisted livings if you're able to go there, or a retirement home. From there, you look into boarding cares. And again, if your medical need is very, very high, where you do need constant medical support, which is also okay, then a skilled nursing facility is probably the best option. Okay. So now, if anyone has any questions, I am more than happy to try to answer to the best of my ability.
Okay, we're going to pause just for a minute, Crystal,
Okay.
so we can stop the video,
Okay.
stop the recording.